Today on Daily Checkup, we're going to be investigating the disease bronchitis. Today we have a patient with/recovering from bronchitis. Her name is Eden Pearson, and we are currently in her house. We will also be talking to her doctor, Dr. Chip. Before we talk to Eden, we are going to talk to her doctor to find out more about this disease. Bronchitis is inflammation of the mucous membranes in the bronchial tubes, like this. There are two types of bronchitis: acute, which is short-term, like 2 to 3 weeks, and chronic, which is a consistent irritation. Acute bronchitis, which Eden has, is caused by viruses, typically the same one that causes you to have the flu or a cold. Chronic bronchitis is caused by smoking or land air pollution and dust or toxic gases in the workplace or environment. Eden, come in. So Eden, let's hear about your bronchitis. My bronchitis is acute. At first, I thought it was the flu. What kind of symptoms did you have? I experienced a cough, mucus, and I was very tired. My chest really hurt and I had chills with a fever. This is a picture of my fever. Did you see a doctor after these symptoms? Yes, I did. Come see me or any other doctor if your cough lasts more than 3 weeks, prevents you from sleeping, if you have a fever higher than 100.4, you produce discolored mucus or blood. There are a few different risk factors associated with bronchitis. Cigarette smoke, low resistance, which if you have an acute illness or chronic condition that weakens the immune system, you're more vulnerable. Exposure to irritants on the job, gastric reflux, repeated heartburn, and irritation of the throat. Were you exposed to any of these factors? Yes, actually, I had gastric reflux about a week ago. I asked Eden a few questions. I did a physical exam to listen to her lungs, a chest x-ray to determine if she had pneumonia or another condition. That explains her cough. I did a sputum test. Sputum is mucus. It can be tested for other illnesses. And a pulmonary function test. During this test, you blow into a spirometer to measure how much air your lungs can hold and how quickly you can get it all up. This checks for signs of asthma or emphysema, which are other respiratory illnesses. I did not prescribe Eden with any medication because acute bronchitis usually resolves without treatment in about 2 weeks. In some circumstances, a doctor may prescribe antibiotics. It doesn't help bronchitis, but you may have a bacterial infection or a cough medicine if your cough keeps you up at night. So Eden, you've learned a lot about bronchitis. Could you give me a prognosis? With acute bronchitis, it is very good because it usually goes away and you can treat it with cough medicine. As far as I know, chronic bronchitis, there's no cure, but you can go to a specialist that teaches you how to breathe better. What are some tips or things to watch for, Dr. Chip? Things to watch for are pneumonia, because in some cases bronchitis can lead to that. Repeated bronchitis may indicate you are developing chronic obstructive pulmonary disease. To prevent bronchitis, you should avoid cigarette smoke, get vaccinated, and wash your hands. So that's it for your daily checkup.